Hi guys, Scott McConnell with your quick tip. Today we're going to look at pacing and how to identify both mechanical capture and electrical capture for your patient. So let's take a look. Here I have a patient who's set up, who's sinus brady, and we've gotten orders to go ahead and pace. So the first thing that I want to make sure everyone understands, especially with pacing and cardioversion, you want to connect the 3 leads as well. All right, let's take a look at the monitor here. And what we can see is I've already turned the pacer on, and you can see these pacer spikes here that are below the QRS complex, but they are not triggering a QRS complex. In this case, because the milliamps or the electrical output is only at 20. So we're going to raise that. I'm going to take the knob and I'm going to continue to raise until I start seeing a pacer spike and then a QRS complex following it. So right now we're at 40 milliamps, still no capture. 50 milliamps, and there I see capture. So I see a pacer spike and then a preceding QRS complex. Now the next thing you want to check is the rate. In this particular model, here's the rate button right here. And I can see that the rate is already set at 70 beats per minute. I have capture. Remember, the monitor only shows you electrical capture. I need to make sure that I am seeing mechanical capture. And how do I verify mechanical capture? Let's feel a pulse. Do I feel a pulse every time I see a QRS complex here on the monitor? And if I do, you're golden. I now have electrical capture and mechanical capture for my patient. Next steps are to check a set of vital signs and continue treatment of your patient and getting them to the hospital. Scott McConnell for Distance CME, and that was your quick tip